My name is Lopez. I'm the clinical director at Northpoint Recovery, and I'm just here to talk a little bit about the treatment that we have and the professionals that we do have in the building. Now, I'm asked a lot about what the differences between a psychiatrist and a psychologist are, and we do have a psychiatrist on staff, a couple at Northpoint Recovery. Now, they do work in tandem fairly well, and they do a lot of similar things. However, a psychiatrist, some of the biggest differences are a psychiatrist does prescribe medications and a psychologist does not. A psychologist does go to school for quite a while, learning different behavioral and mental health diagnosis, as well as a psychiatrist. And a psychiatrist is also a medical doctor. So they do go to school for quite a while, learning about different medical diagnoses, which we find to be very helpful. Especially when someone is detoxing or dealing with a lot of medical issues when they do come into residential treatment. So we find that that's helpful. We do have that insight, and that's how we best accommodate the patients that we do have in treatment. Now, we also have therapists on staff, quite a few of them. We have licensed social workers, master's level, licensed counselors, master's level, and CADCs. So that's a certified drug and alcohol counselor. Now, they're here to help people work through any kind of qualms that they do have, overcome fears, work through struggles, and most importantly, implement back into the community as a successful member of the society. We do a lot of EMDR therapy, trauma-focused. We do a lot of grief and loss, which we find to be pretty prevalent in the substance abuse arena, and we offer advocacy for family members as well. So the differences between a therapist and a psychologist are kind of minimal, but the psychologist has a great, doctorate education. They help a lot with the individual. A therapist works a lot with family members as well, which we find to be very beneficial in our realm and treatment, so that we can really bring the whole family in, assuming that the client's going to go back out, be back into the community and need that support from their family. However, we can best educate them in the addiction realm, assists us in the treatment, and keeps people in treatment and in recovery long term. We find that to be very beneficial. Northpoint Recovery does have psychiatrists. They do not have psychologists, and they do have therapists. So therapists, counselors, nurses, the whole realm, really clinical and medical that we offer, and we try to just provide great recovery.